Welcome to another episode of Cutting Edge Health. And today, what we're talking about is the following: is what's better for anxiety? Is it the use of TMS, standing for Transcranial Magnetic Stimulation, or ketamine? If we haven't met, I'm Dr. Orlando Landrum, a physician at Cutting Edge Health that helps patients understand how to be able to beat their pain and suffering, whether it's mental or whether it's physical, and how to be able to get back to leading the life that you deserve. Today, we're talking about anxiety. And for many people, I think anxiety is kind of characterized as a treatment or an issue that is no big deal. But it actually is a pretty darn big deal in a lot of different ways for a lot of different people, and it affects their quality of life. So anxiety can have a whole host of different things, whether it's secondary to stress, whether it makes you hectic, whether it makes you intense, whether it's a time-driven thing, but it can cause worry and fret and a number of different things. And for many people that are assessing and seeing of, is this a problem, they feel alone. Well, let me just kind of give you some characterizations of anxiety and how big of a problem it actually happens to be. So there was an evaluation by the National Institutes of Mental Health, and what they found is that the prevalence of anxiety is that it's probably present in 7% of the US adults, and they've seen that range from 7 to probably 10%. So 1 out of 10 patients has some degree of that. They've seen that there's a breakdown that looks like it's more prominent sometimes from age 18 to 44, and sometimes occasionally it's a little bit more prominent based off of gender. One of the other things that they've been able to see is the following, is that the lifetime prevalence can typically increase as we age, and there are a number of people who have anxiety which results in severe impairment. We take a look at that and we kind of couch that a little bit further. Anxiety itself is basically characterized by persistent fear of one or more social or performance situations in which the person is exposed to unfamiliar people or possible scrutiny by others. These individual fears that he or she will act in a way that will be embarrassing and humiliating. And that is significant. For a number of patients, the split in terms of it being mild, moderate, and severe is also pretty significant. It breaks down as the following, is that people that have been assessed, and this was nearly almost 20 years or so ago, of it being mild is 30%, moderate being almost 40%, and serious being 30%. So there's serious cases of anxiety which are present. And what we need to figure out is how can we be able to assess it and how to be able to treat it, right? So in assessing it, there are different types of anxiety that is out there, and the breakdown is pretty demarcated or understood between how to diagnose it. So there's types that are the following. So social anxiety is you might have some degree of blushing, sweating, trembling. You may have a racing heart. You might have stomach aches. You may have rigid posture. You may have difficulty making eye contact. You may have feelings of self-consciousness. When we talk about looking at general anxiety, it's the following symptoms. is that you have restlessness, you're easily fatigued, you have difficulty concentrating, you have irritable, you have actual physical symptoms of headaches, muscle aches, stomach aches, unexplained pains. You may have difficulty falling or staying asleep. I know a number of patients that are like, wow, that's how I characterize anxiety. Well, that might be me. I always kind of feel somewhat tired. I always feel like I have these other sort of unknown sort of pain problems, which are not my primary. Then we have phobias that fit underneath the elements of anxiety. And so there are things like you may have an irrational worry or excessive concerns about encountering a fear object or situation, and you take steps to try to avoid that situation. There's immediate intense anxiety upon encountering that object or situation, and there's unavoidable objects or situation which result in intense anxiety. And then the following is actual panic attacks, where you have a pounding or racing heart, sweating, trembling, tingling, chest pains, feeling of impending doom, and feeling of being out of control. So when we talk about these things, I know that there's a number of people that have a stigma that's associated with, oh, well, you just got to take control, or you just got to find meditative pieces to be able to calm down, or you just got to take medications in order to make some of this work. Well, it doesn't really always work that way. And as a matter of fact, most of the times it doesn't. Let's talk about some of the short-term effects of why anxiety can be problematic, but also some of the long-term, which really are infrequently discussed before we talk about treatments. So some of the short-term effects are the following: is that you can have shaking, you can have fatigue, you can have dizziness, you can have muscle aches, you can have an upset stomach, you can have heart palpitations, you can have breathing problems, and you can have an increased blood pressure, right? So people are like, okay, well, big deal, right? Those things are temporary. Well, let's talk about the long-term effects. Long-term effects is that actually they have shown you can have memory problems with long-term sustainable cognitive deficits that can occur, meaning it could potentially be a precursor for things like dementia down the road. And that is really concerning if we're having anxiousness that results in later life dementia that's associated with it because we weren't able to treat it. That impacts quality of life in older years and need to be addressed. In addition, you can have migraines that can occur. You can have heart problems and risk of heart disease. And they've shown this in actual studies that it's not just palpitations and then, okay, the palpitations are done, but they can result in organic disease. In addition, you can have different illnesses due to a lower immune system. You can have gastrointestinal disorders such as irritable bowel. All right. So what most patients would say is, okay, well, knowing all that, then what are some of my risk factors, doc? How is it likely that I'm going to actually end up getting some of those things? So these are some of the risk factors. So the risk factors include shyness or feeling distressed or nervous in new situations, particularly in childhood, exposure to stressful and negative life or environmental events, a history of anxiety or other mental disorders in biological relatives, and the symptoms can be aggravated by physical health concerns such as thyroid problems, heart arrhythmias, caffeine, or other substances that cause problems like this, right? So then, how impactful is this for someone's life? Well, there's actually an evaluation of this from the RAND group, which looked at anxiety disorders can have broad negative health effects. And what they found is the following, is that if you were to take a look at this chart, and you can see in the bottom nomenclature, it says health utility is a measure of overall health with one being optimal. And you take a look at how impacting back pain can be 0.66. Pulmonary disease can be 0.58, which means that they cause a significant amount of problems and issues. If depression is 0.7, anxiety is 0.68, meaning it can be almost as problematic as having back pain in terms of issues and problems that impact on quality of life. And so when we say that, that's not inconsequential. It's pretty significant. So for those of you who are watching who have anxiety, or you have someone who has anxiety who is important to you, it's not something to say, oh, you know what, no big deal. We can be able to get over it pretty easily. You can be able to manage it and you just kind of just suck it up. Actually, it has a lot more impact on quality of life, both in the here and also in the later, right? And so those things need to be understood, assessed, and evaluated. So to that end, and I'm not sure whether the slides come out as such, but let me show you, is there are actually patients that looked at cognitive decline that were associated with anti-anxiety drugs. And what they found is that there was a number of things that took place by using those medications that, in addition to the cognitive decline that might take place from anxiety alone, is that it could occur with different problems and issues that result, right? So one of the things that we want to kind of do is start to assess, are there treatments for this? Are there ways for us to avoid those traditional medications that might be able to provide value without the side effects of an additional cognitive decline? And so some of those things are going to be the followings. So can transcranial magnetic stim seem to provide value? And transcranial magnetic stim, if you follow our channel, is basically stimulation that's applied to the areas of different portions of the brain with the intent to get a result that can improve different problems, both some that are classified as mental health, as well as some that are classified under the physical component, right? And in doing that, what they found is that there's a number of things that took place. So what they found is that TMS actually has been studied predominantly for PTSD, which is a form in some ways of anxiety type issues. And they were able to find on the right side, as opposed to the left side, traditionally used with depression, is that it gave some degree of effect. And this was a meta-analysis that evaluated that, as mentioned previously. But there haven't been as many studies for TMS to be able to assess this as what has been done for other treatments. So one of the other evals is the following, is TMS within the context of using it for other types of phobias. And what they found is the following, is that there was some degree of improvement with the utilization of TMS in terms of being able to provide benefit. So one of the questions is does this seem to hold true? And is there more value within the context of ketamine comparatively to things like TMS? And so when we take a look, one of the things that we can see is the following. We take a look, we can be able to see that there's actually studies that looked at ketamine and they actually found a significant degree of impact and improvement. And so what they see is that ketamine has been able to achieve improvement in generalized anxiety disorder, as we mentioned of, as well as social anxiety, and that it was able to even provide enough of a benefit that it caused reduction in medications. And the thought process is similar to TMS, is that it worked on the right frontal component, right? And there's other studies that have looked at a similar type dynamic and has shown that there's been benefit, particularly with the utilization of ketamine in the context of the ED, that has resulted in improvements in anxiety pretty much right off the bat. So in looking at those two studies, the things that we've been able to see is if we're comparing TMS to ketamine at the moment, there's probably been a little bit more literature for ketamine to be able to show some degree of value, but TMS is improving in terms of its dynamics. So if we're picking a choice between the two, if we're saying, oh, okay, if we're picking ketamine versus TMS, at the moment, we may consider using ketamine, particularly because there's been more studies that have shown some degree of benefit, but TMS is improving rapidly. And one of the benefits is if it mimics the same thing that we've seen with depression, is that its degree of sustainability and relief in terms of providing a longer term solution may be longer than what we see with ketamine. The other upside is the following, is ketamine currently isn't covered by most insurances, while TMS has been. And there's been an FDA indication for anxiety and also for OCD most recently. So those things are probably going to be covered by insurance in the near future, where you can be able to see some degree of value from using insurance to be able to treat some of those options, particularly for those patients that are resistant to using anxiety meds or have concerns about cognitive impairment at later in life. So I know this has been a really quick, very fast blurb. For those of you who are watching us live, if you have questions, please chime in and ask them. But at the end of the day, the summation is the following. As ketamine has value, TMS has value. And the question is which do you use? And what I'd probably answer is there may be value in using them in conjunction. What we've seen is in depression is there's been a number of studies that have looked at it is the following, is by using both ketamine for the acute phase and TMS for more of the chronic phase, you may get a better result. Okay, I think there's a question that popped up. So what if TMS is not an option, then what? So as I was saying, the elements of TMS is if TMS is not an option, then we're talking about being able to do something like ketamine as a potential trial or treatment. Are there other things that you can do in order to be able to improve this? Of course there are. So the traditional treatment options of being able to use anti-anxiety medications to be able to do different types of psychotherapy, including cognitive behavior therapy, are one of the things that you can be able to do as potential options. And those things kind of fit within the realm. But I think the question is, if TMS is not optimum by itself, can it be used in conjunction to give you a better response? Okay, other questions are side effects of ketamine that Elaine poses. So there's a number of different things that could potentially result, but normally what you see with ketamine, depending on the dosage and the dosage and usage for most studies for anxiety is similar to that for what has been used for depression, which is different for what's used for pain. Normally, when you're using pain treatment for ketamine, it's a higher dose than what you're going to use for either anxiety or depression, right? But at the end of the day, what you're going to sometimes see with ketamine is an increase in blood pressure, an increase potentially in heart rate, and those things can be mitigated, but most of the time they're not significant per se, that it's going to cause problems or organic issues. In addition, the other thing that can occur and is frequent is that you can have some mental disturbances in terms of not impacting your thought process or impacting your cognitive function, but more kind of visualizations and hallucinations in the time frame that you're actually undergoing the ketamine treatment, but resolves rapidly and quickly thereafter. So those are going to be some of the things that you have to kind of look at when you're looking at the two. If there are other questions, you guys can pop in and ask. But at the end of the day, the summation of this is that you can use ketamine, you can use TMS as another adjunct for the traditional type treatments. They provide value. And potentially down the line, as more studies kind of develop, what I think will more than likely take place is, can you be able to show that there's values to being able to potentially do both? Again, I'm Dr. Orlando Landry from Cutting Edge Health, wanting you to be able to figure out how you can be able to punch pain in the face, whether it's mental or this physical, and get back to leading the life that you deserve. If this video was of use for you, hopefully you'll tune in to other videos that help you understand what are your options. What are your options for being able to treat potential challenges that you have from a physical standpoint, from a mental health standpoint, so you can really get the quality of life that you deserve and make sure that you can be able to do the things that you want to be able to do. Thank you for those who joined us live, and thank you for those of you who watch us later. If you think that this is of value, let someone else know about it and subscribe if you're interested in learning more. Thank you so much and have a great day.